Today, we're going to break down a landmark study that points to a potential game changer in how we treat cancer. It all centers around a simple blood test that could totally redefine the fight against bladder cancer after a patient has already had surgery.
Everything really starts with this one huge and incredibly difficult question. Imagine a patient goes through a major operation to remove their bladder. Afterwards, both the doctors and the patient are left with this massive uncertainty. Did we actually get all of it?
And the stakes here are just incredibly high. Because for about half of all these patients, even after that major surgery, the disease will eventually come back. You're basically looking at a coin flip.
This uncertainty puts everyone in a really tough position, forcing them into what you can only describe as a 50-50 gamble.
So, here's the dilemma. What do? Do you give every single patient follow-up treatment, like immunotherapy, to try and kill any cancer cells that might be left? Well, if you do that, you're giving potentially toxic and expensive treatments to the 50% of people who were already cured and didn't need it. The other option? You watch and wait, but then you risk that for the other 50%, those microscopic cancer cells are just going to grow and spread completely unchecked. For years, this has been one of the biggest challenges in the field. But what if there was a way to see the invisible? What if a new technology could find the cancer's unique molecular fingerprint long before any scan could ever pick it up? Well, that technology is called circulating tumor DNA, or ctDNA for short. And think of it like this. Even tiny, microscopic cancer cells left behind after surgery are shedding little fragments of their DNA into the bloodstream. These fragments are like breadcrumbs, or a unique fingerprint that tells us, hey, the cancer is still here, hiding.
So the process itself is actually brilliantly logical. Step 1. After surgery, there might be some microscopic disease left over. Step 2. Those leftover cells release their DNA into the blood. Step 3. A super-sensitive blood test, what we call a liquid biopsy, goes hunting for those fragments. And Step 4. If that test comes back positive, it's a huge signal that the patient is at a very high risk of the cancer coming back. It's basically a way to find a needle in a haystack.
Okay, so that brings us to the trial that put this whole idea to the test, the IMvigor011 trial. The goal here was to see if using the ctDNA-Guided approach could actually make a real difference for patients. Now, this was a serious global study. They enrolled over 700 patients and monitored them with regular blood tests after their surgery. For anyone who tested negative for ctDNA, they were just observed, no extra treatment. But for the ones who tested positive, they were identified as high risk, and that's when they moved into the most critical phase of the trial. And this is where the rubber meets the road. Those high-risk ctDNA-positive patients were randomly split into two groups. One group got an immunotherapy drug called Atezolizumab, the other group got a placebo. This was the ultimate test, right? Does finding these high-risk patients early and treating them actually help? So, the big question is, what did the trial find? The results were hugely anticipated, and they delivered not one, but two massive breakthroughs. Okay, so the first big win was for those high-risk patients. The group that got the real immunotherapy drug stayed cancer-free for a median of almost 10 months, and the placebo group, just 4.8 months. So the bottom line is, the treatment more than doubled the time before the cancer came back. That's a huge deal. But it wasn't just about delaying the cancer's return. It was about extending life. The patients who got the drug lived for a median of nearly 33 months. Compare that to just 21 months for the placebo group. We're talking about a significant survival advantage, almost a full year longer. But remember, that was only half the story. What about all those patients who tested negative for ctDNA, the so-called low-risk group? Well, their outcome is captured by this one really powerful number. And here is the second incredible win of this trial. A whopping 88% of patients who consistently tested negative remained cancer-free 2 years after their surgery. And get this, they did it with zero additional treatment. The blood test successfully found a huge group of people who could be safely spared all the side effects and the cost of therapy they never needed.
So you put those two wins together, and what do you get? You get a powerful new blueprint for much, much smarter cancer treatment.
Let's just be clear about why this is such a big deal. This ctDNA approach is a leap beyond the old methods of just looking at a tumor's size or stage. It lets us give powerful drugs only to the people who truly need them, while giving peace of mind to those who don't. It's about proactively treating microscopic disease. And, this same strategy could potentially work for lots of other cancers, like colon, lung, and breast cancer.
And hey, don't just take my word for it. The study's authors themselves summed it up perfectly in their paper, saying that this approach could fundamentally redefine the way that we consider patient selection for therapy. That's the kind of statement that signals a real shift in clinical practice.
So at the end of the day, this trial gave us a clear win-win. We can treat the high-risk patients better and more effectively, and we can spare the low-risk patients from treatment they don't need. It's a huge step forward, and it leaves us with one final, very exciting question. Are we looking at the future of truly personalized cancer care?